Good morning, dear students. My name is Fakhrudina Varoza Valerievna. I'm the resident of the second course at Department of Psychiatry. I want to introduce you the presentation about psychiatry subject. The topic of the day is evaluation of mental status of the Republic of Kazakhstan. Plan of the lecture. Algorithm for assessing the mental status of the Republic of Kazakhstan. A study of mental status is a study of the patient's mental state at the moment by assessing his appearance, behavior, the presence of unusual strange ideas or feelings, for example, illusions or hallucinations, mood, and all aspects of cognitive activity, for example, attention, orientation, memory. Assessment of mental status is carried out in each patient with his violation or in the case of progressive, acute, or chronic decline in cognitive functions. Many screening scales are available. Particularly appropriate are the following. The Montreal Cognitive Function Assessment Scale is used for general screening because it covers a wide range of cognitive functions. Mental Health Assessment Brief Scale. Example of this scale you can see on your screen. Pathology of consciousness, allo, auto, and somatopsychic orientation. They evaluate the subject's of orientation in his own personality, place, time, current events, and surrounding people. The following questions must be asked. What is your name, age? Who did you come with? Who does he/she have? What is the day of the week, month, year? Where are you now? Who surrounds you? Doctors in lab coats, nurses? Do you remember how you got to the hospital clinic? Do you consider yourself sick? Assessment of thinking. The failure of such operational thinking as analysis, synthesis, generalization, exclusion of excess are often found in various disorders of the sphere of thinking. The following question must be asked. Do you have any conditions in which it is difficult to cope with the flow of thoughts? Do you feel a sudden emptiness in your head? A failure of thoughts, a sudden breakdown of thoughts occurs. Do you have unpleasant, obsessive thoughts or motives? Do you think that you are being watched, that you are being persecuted? Do you have a feeling that you are being affected somehow? Who? For what purpose? Do you suspect your wife, your husband, of treason? Do you have unusual abilities? Tremendous power, immortality, great wealth, great scientific discoveries. Perception assessment. Perceptual impairment is determined by examining a patient, observing his behavior, questioning, studying drawings, and writing. Objective sign of the presence of illusions and hallucinations can be established much less often than to obtain relevant information from the patient himself. The following question must be asked. Have you had any experience that could be called visions? Do you see them with your eyes or inner gaze? Do you hear any inner voices from outside when you are alone? You say that these voices speak with you. Can you say that we say? Have you noticed that you began to smell the usual smell somehow differently? Do you feel that ordinary food has changed its taste? Do you feel a foreign body in the skin? Touching, stroking, and other influences when there is nobody near you? Do you feel then the objects around you seem distorted to you? Have you felt a temporary increase in your body or parts of the body with your eyes closed or open? Memory rating. In the process of collecting an anamnesis, questions should be asked about the presence of constant difficulties in remembering. During the examination, patients are offered tests to Assess memory for current, recent, and long-term events. The following question must be asked. Do you have any memory impairment? Do you have a good, bad memory? Do you remember well what you read, memorize by heart? Do you have any difficulties in reproducing in your memory life situation from the past? Do you remember my name? Can you tell me how long you are in the hospital? What is today's date? Do you have a feeling of forcibly reproducing life situation from the past in your memory? What did you eat for the breakfast today? Intelligence score. The following question must be asked. Did you go to school? How many classes have you completed? Do you know how to write? Do you know how to count? Can you read? Do you do housework on your own? Eating, putting on clothes, hygiene measures. Without labor, you can't even take a fish out of a pond. Explain the meaning of the proverb. Horse and ram, airplane and car, what are the differences and similarities? How much will it be if you subtract 5 from 100? If the answer correctly, how much will it be if you take 5 from 95? What season follows after summer? Table, chair, cat, sofa. Take away the extra word. Without 10 minutes for tea. 14. Display as a picture on the watch dial. Attention rating. Concentration is the ability to maintain this concentration. During the collection of the anamnesis, the doctor should monitor the attention and its concentration in the patient. Need to ask, can you work in a noisy environment? Do you have difficulty learning new information in a short period of time? Can you distracted even from a very important and interesting business? Do you follow the steps involved in performing a particular job? Do you complete the work you have begun? Do extraneous sounds bother you when you work? How carefully do you do the job? Can you do several things at once? How often do you make mistakes when doing particular important things? Can you highlight an important part of the information received? Assessment of the emotional volitional sphere. The assessment of mood begins with observation of behavior and continues with the help of direct questions. Do you easily succumb to mood swings from no apparent reason? How often do you have low mood? How often do you feel elevated? Do you have a high mood at the moment of grief or a low mood at the moment of joy? Are you always so sluggish? How do you imagine your future? Do you ever think that living is not worth it? What would you be better off dying? Committing suicide? If you died, what was to happen after that? Do you have difficulty getting up in the morning? Do you have a desire to fall asleep and not to wake up? When assessing patients' awareness of their mental state, it is necessary to remember the complexity of this concept you need to evaluate. Awareness of the disease by the patient, type of relation to the disease, critical attitude of the patient. With that, the patient connects his appearance illness. In conclusion, I want to say that according to this information, you can evaluate the mental status of your patient. As a result, make correct conclusion and correct diagnosis. Thank you for your attention.